Welcome to our channel. Today, we're delving into a crucial health topic, the symptoms of stomach cancer. This silent disease often goes unnoticed until it's advanced, so understanding its signs and symptoms can make a significant difference. Let's dive in. Stomach malignant growth, otherwise called gastric disease, grows gradually over numerous years. Early side effects are frequently unpretentious and can be effortlessly confused with other less difficult circumstances. In any case, early location is critical to fruitful treatment. In this video, we'll investigate both the early and high-level side effects of stomach disease, as well as when to see a specialist. To start with, how about we check out at the early side effects of stomach malignant growth? These side effects can frequently be obscure and vague, which is the reason they can be neglected. One of the most widely recognized early side effects is tireless heartburn or distress in the upper mid-region. This isn't a periodic indigestion large numbers of us experience after a major dinner. It's a constant, progressing issue. Then, you could feel full subsequent to eating limited quantities of food, known as early satiety. This can prompt unexpected weight reduction as you eat less after some time. Gentle sickness is another side effect. It might go back and forth, and isn't generally sufficiently extreme to cause alert. Nonetheless, on the off chance that it continues, it's significant. Loss of hunger is likewise normal. In the event that you observe that you're simply not keen on food like you used to be, it very well may be an indication of something more serious. As stomach malignant growth advances, the side effects become more articulated and can altogether influence your personal satisfaction. We should investigate these high-level side effects. Unexplained weight reduction is a significant warning. In the event that you're getting in shape without changing your eating routine or exercise propensities, now is the ideal time to see a specialist. Industrious stomach torment or uneasiness is another key side effect. This aggravation might be consistent or come and go, and it frequently demolishes after dinners. Retching, particularly assuming it incorporates blood, is a serious side effect that requires quick clinical consideration. Diligent heaving without a reasonable reason is likewise disturbing. Trouble gulping, or dysphagia, can happen in the event that the growth is close to the intersection of the stomach and throat. This can make eating and drinking excruciating or troublesome. Enlarging or liquid development in the midsection, known as ascites, can cause perceptible expanding and uneasiness. Exhaustion and shortcoming are normal as the disease advances, frequently because of iron deficiency or unhealthiness. Blood in the stool, which might show up as dark, delay stools, is an indication that there might be draining in the stomach. This is another side effect that needs prompt clinical assessment. There are additionally more uncommon side effects of stomach malignant growth that can show up, however, they are not as broadly perceived. Jaundice, or the yellowing of the skin and eyes, may happen assuming the malignant growth spreads to the liver. This is a significant side effect, showing progressed infection. Determined hiccups that are challenging to stop can be an astonishing side effect of stomach malignant growth. While they might appear to be innocuous, assuming that they persevere, they ought to be explored. Stomach swelling that doesn't appear to be connected with food admission is another side effect that ought not be overlooked. It's vital to know when to see a specialist. Here are a few rules. In the event that you experience steady side effects that don't improve with over-the-counter medicines, now is the right time to counsel a medical services supplier. Huge weight reduction or loss of craving ought to incite a specialist's visit. Trouble gulping or determined stomach torment are likewise motivations to look for clinical guidance. Assuming you upchuck blood or notice blood in your stool, look for surefire clinical consideration. Understanding the gamble factors for stomach disease can assist with recognizing people who may be at higher gamble. Age is a critical gamble factor. Most stomach malignant growth patients are north of 55. Orientation likewise assumes a part, with men being bound to foster stomach malignant growth than ladies. Dietary decisions can increment risk. Slims down high in smoked, salted, or cured food varieties are especially unsettling. Both smoking and liquor are critical gamble factors for stomach malignant growth, a persistent disease with Helicobacter pylori, a kind of microscopic organisms, can prompt irritation and changes in the stomach lining, expanding the gamble of malignant growth. Hereditary variables are additionally significant. A family background of stomach malignant growth, or certain hereditary circumstances, can raise your gamble. Assuming that stomach disease is thought, specialists might suggest a few indicative tests. Endoscopy is a typical technique that permits specialists to see the stomach lining straightforwardly and take biopsies of dubious regions. Imaging tests like CT examines, PET outputs, and X-beams can assist with deciding the degree of the disease. Blood tests can check for sickliness or different anomalies that could demonstrate malignant growth. A biopsy, where tissue tests are inspected for malignant growth cells, is in many cases conclusive in diagnosing stomach disease. While the side effects of stomach malignant growth can be inconspicuous and handily confused with different circumstances, monitoring them can prompt prior conclusion and improved results. Ordinary checkups and conversations with medical services suppliers are significant, particularly for people with risk factors. Assuming you experience any determined side effects, it is critical to speedily look for clinical guidance. Thank you for watching. If you found this information helpful, please like, share, and subscribe to our channel for more health and nutrition content. Stay informed, stay healthy, and take care of yourselves.